So yes, your implant can actually slip out from under the muscle even if it was initially placed there. Most patients who have an under the muscle augmentation have something called a dual plane, where we release the muscle from where it's attached in the center of your chest. And that allows the implant to sit a little bit lower and look a bit more natural. So there's a few things that can cause it to slip out from under the muscle. Number one, lower pole stretch. So if your capsule is really thin, your implant's really large, your surgeon was messing around moving your crease lower, all of those things can make the lower pole, the lower portion of the implant not stay where it's supposed to and drift down too far. And the muscle often stays, or usually stays where it is, and the lower capsule stretches and down goes the implant, and it can slip out from under the muscle. Another situation where this happens is if the muscle was just way too over-released for whatever reason. So your surgeon didn't just release a little portion of the muscle, they released a lot, too much. And then the muscle will retract and it will look like a bunch of tissue on top of the implant. And we usually can tell this easily from physical exam. And then the final reason is capsular contracture. So if you have a bad capsular contracture, sometimes the muscle will retract up into a little fibrotic wad over your implant, and your implant will be really not under it anymore when we go in there for a revision. So how do you fix this problem? The first thing to do is to diagnose what caused it to slip out from under the muscle, and then also decide whether you're keeping it under the muscle or going to transition to over the muscle. Now, if it's a contracture, you fix the contracture. You often, for long-term contractures, can never get the muscle back down where it belongs, so that's important to recognize. And if the lower pole has stretched or the muscle has been over-released, you usually need something to tether that muscle back down, like a piece of scaffolding mesh or dermal matrix. So this is a problem we encounter all the time in the operating room. Most patients aren't aware of it when they come into the office. I'll tell them what's going on. So it's not something most people notice. It doesn't really change the appearance of your augmentation in a way that makes it obvious what's going on. But it's important to know that that is happening, so when you go back in for a revision, you get everything fixed the way it should be.